Hi everybody, I'm Steve Stivers. I'm honored to represent you in Congress. We've started a new thing called the Ask Steve video series, where we address questions we've gotten frequently in letters, in emails, on Facebook at Rep. Steve Stivers, or on our Twitter. So if you are interested in submitting a question for the Ask Steve video series, please submit it and we'll try to see if we can use it. We're going to try to do the ones that we get most frequently. So please submit questions and we'd love to hear you. If you don't get what you need from the video series, you can always call our office at 202-225-2015, or you can go to my website at www.stivers.house.gov to get more information. But thanks for joining us for the Ask Steve video series, and now we'll move to questions. The first thing comes from a letter from Brian from Circleville, who wanted to write about the special diabetes program. And I'm honored to support the special diabetes program. The special diabetes program is a dedicated research stream of dollars that goes to researching diabetes. And as many of you know, the complications from diabetes, whether it's blindness or amputations, cost so much more than treating diabetes. And diabetes is getting to be an epidemic in our country, and we need to make sure that we dedicate research dollars toward diabetes and that we support folks who have diabetes. So that's why I've always supported the special diabetes program inside the National Institute of Health. And Brian, thanks for asking about that, and I'm happy to support it. With regard to people losing their insurance plans, I've heard from lots of folks. A couple of people I'll single out is I heard from Tawna on Facebook, and I heard from Dean, who called our office. He's from Athens. Dean was concerned about the president acting instead of Congress acting, and Tawna seemed to be supporting the president's action. I will tell you, I think our Constitution is pretty clear. Article 1 talks about Congress. Article 1, Section 8 talks about the powers of Congress. It's Congress's job to make the laws. If we're going to change a law, including the Affordable Care Act, Congress needs to act. Article 2 is about the executive and what the president can do. The president does not have unlimited authority to make executive orders. This is not a monarchy. This is not a dictatorship. This is a republic. We have to use our Constitution. The Constitution requires Congress to act on things like this. I supported the Keep Your Health Plan Act because I think it will make a difference. And frankly, I support our Constitution. I think we need to follow the Constitution. And that's why I supported the Keep Your Health Plan Act, because I wanted to allow these people, these 1.3 million people who have already had their insurance plans canceled, to be able to keep their insurance. But I don't think we should circumvent the Constitution of the United States. And frankly, when the president does executive orders that he doesn't have power to do under Article 2 of the Constitution, that's a problem. So I supported the Keep Your Health Plan Act. I think it will help people. I'm hoping that it will work out. But I still think the Affordable Care Act has more problems than good. It has too many taxes. It puts the government between the doctor and the patient, and it creates lots of problems in our healthcare system. It's driving up costs, not driving down costs. What we need is market-based innovations. We need to deal with some of our problems in healthcare. We need tort reform. We need tax reform. We need Food and Drug Administration reform. We need to make sure that we make healthcare affordable so more people can get it. So there are real reforms we can support. I think we also need some insurance reform, like pre-existing condition, some things that the healthcare bill did well. But frankly, the healthcare bill created more harm than good, and we're seeing it now. And people are getting their healthcare policies that they liked canceled. And the president said, if you like what you got, you can keep it. I also heard from a Boy Scout from Troop 90 in Plain City. He's doing one of his merit badges, and the issue he wanted to write about is bullying. And thanks for writing about it. Bullying does affect a lot of teenagers and frankly a lot of folks in this country, and it affects the entire family. Bullying is a cultural issue. That's something we have to try to fix, and it's something that I'm glad you care about, because it does affect a lot of our young folks and even older folks. What we need to do is build a culture of respect. I've been in the Army for 28 years now, and one of the Army values is respect. I was also a Boy Scout. I was an Eagle Scout. Thanks for your work in the troop and your willingness to do merit badges and get some rank and hopefully become an Eagle Scout as well. And even in the Boy Scout laws, a Boy Scout is courteous and kind. And we need to build that culture across our country, because our republic, our government only works, and our society only works when we truly respect each other and learn from each other. And bullying is what folks do when they don't respect each other and when they aren't open to somebody else's point of view. So it's about all of us growing as people. There's things that we might be able to do in government. There's things that each of us can do in our daily lives. If you confront bullying, stand up to it. That will help make sure everybody understands it's not an acceptable thing. And make sure you tell somebody about it and let the authorities, whether it's a principal in school or a teacher in school know, or just adults that can help address the situation. So thanks for caring about bullying. It's something that is unacceptable and something I think we've got to try to change our culture in this country. And I really appreciate your willingness to work on it, and good luck to Troop 90 and all the Boy Scouts out there, and good luck on your merit badge. I also heard from some students at Madison Plains High School. They wrote in a lot about veterans issues, and we'll get letters back to you for your individual questions. But thanks for writing. Thanks for caring about our veterans. Thanks for so many of you who shared a story about how veterans have made a difference in your lives and for our country in our Thank a Veteran series around Veterans Day. Really appreciate you participating in that. I thought I'd give all of you an update on some things I've worked on veterans issues and I'm working on going forward. Last year we passed 2 of my bills, the TRICARE for Kids bill that will help ensure that young folks insured by TRICARE don't fall through the gaps in the system, and also the Hire at Home Act that'll make sure any soldier, sailor, airman, or Marine who got training from the government in the military can use that training back here when they get home and not have to pay twice to get that education a second time in a civilian setting. So that'll ensure that truck drivers and medical professionals can use their skills and get certifications here at home and go into many careers that have shortages today. So we're excited about that bill. It's starting to be implemented now. Working on a couple things still, trying to do something for the veterans backlog. We still have about 750,000 claims of a backlog in this country. It was 1 million. We've done a little bit, but there's much more work to be done, and we need to stay focused on it. I'm also working on an Honor Those Who Serve bill, which will ensure that all of our soldiers, sailors, airmen, and Marines, all our veterans, get a headstone at their gravesite or can qualify for one. Right now, if you're a homeless vet, or if you're a veteran from an older war where your next of kin can't be identified, you cannot get a VA headstone. We need to make sure that everybody's service is honored, even homeless vets and even folks from previous wars. Just because their next of kin can't be identified doesn't mean they shouldn't qualify for a headstone. So we're working to fix that, working with the Veterans Administration, hoping we can get this fixed pretty quickly. Thanks for your care and interest about our veterans. And I really appreciate the students at Madison Plains for writing in. And thank you so much, everybody, for participating in the Ask Steve video series.